Tell your mommy to get it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart. And always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Self-health management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus.
Is on.
Good day and welcome once again to our National Emergency Operations Center COVID-19 weekly briefing. Today, Wednesday, the 2nd day of February 2022. Thank you very much for joining us for our briefing today. You continue to be an important part of the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. As all of us are aware, the pandemic is still here with us, and we have to manage it the best way that we could. So thank you very much for your attention and for being with us today. I first would like to invite to give us his presentation the Medical Chief of Staff at the Joseph Nathaniel France General Hospital, Dr. Cameron Wilkinson.
Thank you, Leslie. Good afternoon to all. Near 2 years into this pandemic, many of us are having coronavirus fatigue or pandemic burnout. We all want to begin to do more. We want to get back to the way things were in the pre-pandemic era. For some, this includes mass gatherings at concerts and sporting events. I do believe we are at a stage in this pandemic where we should be able to gather again, but must do so more safely. We must remember that the virus has been relentless in its attack, and we must be relentless in our defense. Therefore, we cannot afford to get complacent even as we have passed the peak in this fourth wave. If we must gather en masse, then we should add the layers of safety precautions that we know have been proven to protect us. These include the wearing of an appropriate mask appropriately, hand sanitizing, and giving ourselves the best layer of protection, which is being vaccinated and boosted where indicated. We have recorded an additional 4 deaths over the last 48 hours. With pre-existing conditions, it does not mean that one should not be vaccinated. Just because one is elderly with pre-existing conditions, it does not mean that one should die from COVID if get infected. There are many persons in their 70s, 80s, and 90s who have gotten COVID in this fourth wave but survived with little or no symptoms because they were vaccinated and boosted. We all need to, at this point, take more personal responsibility in this fight and opt to get the best personal protection, which is to be vaccinated. I said last week, and I will say again, across the globe, governments are retracting in the impositions placed to control the virus with curfews, lockdowns, and strict protocols such as bans on mass gatherings, and placing more responsibility at the individual level. We need to take more personal responsibility in this fight if we want to see further relaxation of the restrictions here. If we are responsible for an elderly person or a child between the age of 12 to 17, we need to make sure that we make the right decision, which is to have them get vaccinated to save their lives. If you are an adult, 18 or over, you need to make that decision to get vaccinated for your own personal protection. If you continue to listen to those who tell you to put yourself on the waiting list for a better vaccine, you are putting yourself on the list with those who may die if they get infected. We are yet to take care of someone who is severely ill or died from COVID who is fully vaccinated and boosted. Irresponsible people are still spreading misinformation and promoting vaccine hesitancy, which is causing people their lives. How many more must die before we begin to take this virus seriously? With 86.8% of adults in St. Kitts with protection from at least one shot, there is an 86.8% chance that the adult in the room who is telling you not to get vaccinated is already personally protected through vaccination and is misleading you. If you are part of the 13.2% of adults in St. Kitts or 30% in Nevis who have no protection through vaccination, you need to go out and be vaccinated. There are some who are still saying that they will get protection through herd immunity so that they themselves do not have to get vaccinated. CDC officials stated for the first time that they no longer consider herd immunity a goal for COVID-19. This means that the health agency no longer believes that the disease will functionally disappear in the face of high vaccination rates. This was no surprise to us here. We have said here before that there will be no herd immunity day. There is no magic percentage vaccination coverage we reach and drop our guards and switch everything back to normal. Everyone who can be vaccinated should be vaccinated. While vaccines have been miraculously effective in preventing severe illness, they don't fully stop transmission, especially against the highly transmissible Omicron variant. That fact, coupled with the still high number of people who are choosing not to get vaccinated, means that it is very unlikely that vaccines will stop the spread of COVID in the way it has worked with measles and other viral illnesses that were halted by high vaccination coverage, leading to herd immunity protection. The idea of having unvaccinated persons protected by the herd in this pandemic is therefore slowly disappearing as the scientific evidence has unfolded the stark reality that, if vaccinated, though protected from severe disease, hospitalization, and death, you may still transmit the virus. Each of us, more so now, need to make that personal decision to protect ourselves and stop this infection from becoming a personal death sentence. We are nearing the second-year anniversary since the coronavirus responsible for COVID-19 was identified. In near 2 years, it has infected over 382 million people, resulting in 5.69 million deaths. We have contributed 37 deaths to that toll, many of which could have been prevented through vaccination. The longer the virus stays around, it will continue to mutate, and scientists will have to dig deep into the Greek alphabet to find names. The Omicron variant is highly transmissible and has quickly become the dominant strain globally. With Omicron becoming the dominant strain and associated with less severe disease, there is a tendency for people to take the infection it causes lightly. Please remember that less severe disease does not mean mild disease. It can still cause severe disease and long COVID, as well as putting a strain on the workforce, particularly the health workforce, the supply chain, and local and global economies. There is now the new Omicron subvariant known as BA.2, which is 1.5 times more transmissible than the original Omicron strain. Nearly half of the US states have confirmed the presence of BA.2. This means it is only a matter of time before the new subvariant reaches our shores. The good news is that BA.2 is so far not associated with more severe disease, and the vaccines still appear to be effective against symptomatic infection. The best preventive measures and the path to near normalcy, which you so much desire, still remain: 1, vaccination, and getting boosted if you're an adult, 18 years and older, and you have received your primary series 5 months ago, a good quality mask, social distancing, and for some, testing before gathering persons outside of your home. Please make the decision to go out and get vaccinated. That is our only path towards normalcy. Thank you.
Thank you very much, Dr. Wilkinson, on the importance of getting vaccinated, if that was the subject of your presentation today. I want to thank the Honorable Wendy Phipps for always being here. She's here today, and she is the co-chair of the Disaster Mitigation Council. I now would invite Dr. Hazel Laws, our Chief Medical Officer, to present us with the Health Emergency Operating Committee Situation Report for today.
Thank you, Mr. Williams, and good afternoon to everyone. We have been rolling out or administering the COVID-19 vaccines for almost 1 year. And to date, we have achieved the following coverage rates. 82.1% of the adults in our population have come forward and accepted the first dose. 76.6% of the adults are fully vaccinated. And we are happy that 8.5% of the adults in the population have come forward and requested their booster shot. So 8.5% of the adults are boosted. In terms of the teenagers, 12 to 17 years, 18.1% of children in this age group, they have received the first dose, and 15.8% are fully vaccinated. Now, this slide shows the data, the vaccination data disaggregated by island, but it's important to note that when we look at the total population, 55.3% of the entire population in the Federation are fully vaccinated. That's an achievement, but we still have work to do. We have a 45% of the population still to come on board in terms of being fully vaccinated. Now, this slide shows that over this past week, we've added 115 newly diagnosed cases of COVID-19. Last Wednesday, that previous week was 305 cases. This week, it's 115. So, ladies and gentlemen, the numbers, the daily count is going down, and we are happy for this. Now, in terms of the recovered cases, over this past week, we have identified 322 cases who have fully recovered from COVID-19, and for this we are thankful. This shows the epi curve, and we are on the other side of the curve. The cases peaked in the earlier part of January, the first week in January, and I think round about the 20th of January, that's when we saw the peak in terms of the total number, the highest number of persons recovering in any one day, over 300, and that was around the 20th of January. And so we are doing quite a good job in terms of containing this fourth wave of COVID-19 infections that started Christmas Eve 2021. Now, during this wave, we added a total of 2,624 cases. We have had 2,295 of these cases recovering. And so currently, the case managers, they are monitoring 342 active cases. Now, over this past few days, we've added 9 COVID-19 related deaths. And I'll share a little bit more about these cases of COVID-19 related deaths. Before doing so, I want to speak about recovery, just sharing some data that came out in our HEOC meeting this morning. If you are fully vaccinated and you've been diagnosed with COVID-19, the average time to recovery is approximately 7 days. If you are unvaccinated, the average time to recovery is approximately 12 days. But based on the data, we are noticing that persons who are fully vaccinated, if you have underlying chronic conditions like diabetes, you may experience a longer time to recovery. And it's the same, or it's similar in terms of those who are unvaccinated. If you have underlying chronic conditions, when we test to see if you have recovered, it usually takes a little longer than 12 days. Now, in terms of the 9 recently reported COVID-19 related deaths, it's important to note that these individuals were all unvaccinated. They were older adults and they had underlying chronic conditions. WHO says that older persons with underlying chronic conditions, they are experiencing an elevated risk of severe COVID disease. That means these individuals are at an increased risk of being admitted and going on the ventilator and even dying. So unvaccinated persons face a higher risk of becoming severely ill. Vaccinated individuals, on the other hand, generally experience mild illness, and those who do have breakthrough infections, they just have mild symptoms. In 1 or 2 days, they recover without much problems. This may be repetitious, but it's important for me to underscore that the most vulnerable persons amongst us at this time are the older adults who are unvaccinated and who have underlying chronic conditions. And so when I look at the demographic information about the persons who recently died, I realized that these individuals weren't going out regularly. They didn't go out and pick up COVID or Omicron. Based on the information we have, what we are surmising is that these individuals picked up the infection from their loved ones, from persons in their social network. So their children, their grandchildren, nieces, nephews, sons, daughters are the individuals who brought COVID home to them. They succumbed to the illness. And so we want persons in families, in social networks, to be careful when interacting with the older adults in your social network, especially those older adults who are unvaccinated. Because if they do become ill, their risk of getting severely ill, their risk of being admitted is high. This slide shows or highlights the current situation. So to date, the Federation has reported a total of 5,446 confirmed cases of COVID-19, and 5,067 of these cases have fully recovered. We are monitoring 342 active cases as we speak. And the total number of COVID-19 related deaths over the entire period of the pandemic is 37. 6 reported for Nevis, 31 reported for St. Kitts. Just some additional data regarding the 37 persons who have passed. In terms of their gender, 2/3 were male, 1/3 about were female. 89% of the individuals who died from COVID were unvaccinated, and they were mainly older adults. 78% of the individuals were over 60. And so this is very important. Again, we want to pause and reach out to those individuals who have not yet come on board in terms of accepting the vaccine. I want to implore you, I want to, I'm beseeching that you recognize your vulnerability, empower yourself with the latest information about the vaccines, and recognize that the vaccines do provide that layer of protection, and it helps you to combat this virus. Some persons are saying Omicron just causes a mild disease and they will take their chance. But I don't want us to become nonchalant and, take this new variant for granted, because there are individuals who have become seriously ill, even with Omicron. And you know, we get the testimonies daily. Those individuals who have gone through the experience and who have recovered, they tell you that, you know, they are happy that they made that decision and took the vaccine because it gave them that fighting chance, that layer of protection that helped them to overcome and recover. Long COVID. So yes, those persons who have been diagnosed with COVID, they are very happy when they get that call saying that their recovery test is negative and they are recovered. However, there are some persons who have had that call, gotten that call. They go on to describe symptoms, long-standing symptoms, or what we deem long COVID. Some of these symptoms include malaise, fatigue, brain fog, just to name a few. Now, long COVID has been a challenge as health entities and countries have different practices and requirements for making the diagnosis. So in the United Kingdom, for example, you have to be experiencing or complaining of some of these symptoms for as long as 3 months before you are diagnosed with long COVID, whereas in the United States of America, in about 4 weeks. If these symptoms persist for a month, the diagnosis may be made. All persons who have had COVID-19, whether they were hospitalized or may have only had mild symptoms, you can experience long COVID. So what this is really saying is that even persons who just had mild symptoms, maybe chills, fever, a little fatigue for about 3-4 days, and you may have recovered, you can still go on to experience be diagnosed as having long COVID. So COVID is not as simple as some persons are making it out to be. Studies have shown that even mild cases of COVID-19 can trigger persistent symptoms, and individuals can be impacted by COVID for 6 months, even a year after getting that negative test result saying that you have recovered. Now, long COVID can happen no matter what virus variant occurs, and there's no evidence that there's any difference between Delta, Beta, or even now Omicron. Omicron came to the fore in November of last year, so not enough time has elapsed for the scientists to say emphatically, you know, what are the signs and symptoms of long COVID secondary to Omicron. Now, although getting vaccinated significantly lowers the risk of developing long COVID, reinfection may cause a flare-up in symptoms. So it's important to note that. It is too soon to know, scientists say, but mild initial illness may not signal reduced risk. So yes, let me just repeat. So if you were diagnosed with COVID during this 4th wave, which would be due to the Omicron variant, if your symptoms were mild, yes, there is a lower risk of developing long COVID, but there is still a risk of you experiencing persistent symptoms. The scientists are still, monitoring individuals to determine what your experience will be like, but there is still a risk. So ladies and gentlemen, we cannot take Omicron for granted. We cannot be nonchalant about it. We need to do all we can in terms of prevention and control. And so preventing COVID, preventing your risk of exposure to Omicron is still very, very important, particularly in our older adults who are unvaccinated and those with underlying chronic conditions, which includes diabetes and stroke or cerebrovascular accidents. Now, last week I shared some information coming out of CDC whereby we are told that children who have been impacted with Omicron they are showing an increased tendency of developing diabetes. And so that is one reason why, parents and guardians need to really consider and consent, provide consent for children between the ages of 12 to 17 in terms of being vaccinated. Getting more young school-age children vaccinated is crucial for ending this pandemic. Public health officials say that persuading parents to get their younger children vaccinated is crucial, not only to sustaining in-person education, but also to containing the pandemic overall. Because just think about it. Once your son, daughter, niece, nephew leaves home to go to school, they are exposed during the trek to school. They are exposed during the break time, during lunch break, while even in the classroom. And so give your child that added protection, that added layer of protection through vaccination. So there are many reasons why you really should consider providing consent for your child to be vaccinated. The vaccines are there. Those 12 to 17-year-olds, they are eligible. Last but not least, we want you to wear your face mask at all times when in the public places, like you're going to the bank, going to a restaurant, yes, when you're not eating and drinking, going to pay your utility bills, and if you're going to a family gathering. We want you to maintain adequate hand hygiene. If you are, if there is an exchange or transfer of, paper, whatever it is between yourself and another, you make sure to sanitize your hands before and after. And maintenance of that adequate distance between yourselves and others, very important. And there are a number of individuals who are experiencing COVID-like symptoms, and they are still going on the bus, public transport with others. They are still going to work. And there are some children who are experiencing COVID-like symptoms, and they are still being sent to school. Ladies and gentlemen, if your child is experiencing any of the COVID-like symptoms, please have them remain at home. These symptoms include fever, chills, aches and pains, unusual aches and pains, a cough, shortness of breath, just to name a few. Some complain of vomiting, even diarrhea. These are some of the main complaints of persons impacted by COVID at this time. So if you are experiencing any of these symptoms, you need to really remain at home and seek medical care and get tested. We end on that note. Thank you.
Thank you, Dr. Laws, for ending on that note, the beauty of a flower. That is quite good. I want to invite now Superintendent Cromwell Henry, who is the man that deals with the regulations, the COVID-19 regulations, to give us his presentation.
Thank you very much, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. My presentation today will again focus on social events and other activities that attract or have the potential to attract large gatherings. At a previous COVID-19 briefing, Minister Phipps had announced that Cabinet had placed a hold on permissions granted to host social events with mass gatherings, and this was due primarily to the wave of new COVID-19 infections in the Federation. While we are seeing new infections trending downwards and the number of active cases reducing daily, the stay on permissions is still in effect and will be for the month of February, when we expect the numbers to go down to satisfactory levels. We therefore continue to ask for your patient. Social activities with small gatherings that are adequately spaced are still permitted. Bars and restaurants are allowed to operate. We just ask that you adhere to the provisions of the COVID-19 Act, which require persons to adhere to social and physical distancing protocols, hygiene protocols, and the wearing of face masks, except when you're eating or drinking. I would like to take this opportunity again to remind us all that especially event organizers, that all public events require permission from the police. Bands and DJs also require permission to play loud music in any public place. We are seeing some persons taking risks to host events or play loud music at bars and other night spots without permission. We ask that you desist from this practice, as the consequences to you could be severe in terms of fines or tickets or even arrests. Sorry, when I say fines, I meant court fines. Court fines or tickets or even arrests. In closing, I will again remind you that we are still managing a pandemic which requires certain behavior from all of us. We ask that you avoid crowds and crowded places, practice good hand hygiene and other sanitization behavior, wear a face mask when in public, and get vaccinated if at all possible. Thank you.
Thank you, Superintendent Henry. I now invite the chair of the National COVID-19 Task Force, Mr. Abdias Samuel, to give us his presentation.
Pleasant good afternoon to all. Mr. Williams, thank you for your introduction and the work that you have been doing for the past 2 years. My presentation is going to be brief this time, very brief indeed. I was just concerned when Dr. Laws spoke about pain, Dr. Wilkinson, because I started my New Year's resolution yesterday and I'm feeling pain, so I hope it's not COVID pain. Right. Again, independent of my colleague today, based on the reports we have been receiving, I too wanted to start my presentation with an appeal to the general public for the protection of the vulnerable groups in our community. And I want to encourage you to apply the non-pharmaceutical measures, do your best to protect your families, those who are elderly at home, and as Dr. Laws would have stated, and Dr. Wilkinson before me, those who have underlying conditions. And I want to end this particular appeal to you by asking you to get yourself vaccinated if you're not, those who have their elderly parents or whomever living with you, or if not, if you can encourage them to be vaccinated or at least permit them to be vaccinated is very important. I don't wish for us to have no more death in that particular demographic group, as this is very disturbing and alarming for us as a National Crisis Center, Management Center. Vulnerable groups are one of the groups that we have to protect in our society. And this appeal is for you to protect that particular group in our society. Please do your best. Do it now. If you're going somewhere, protect yourself. If you're coming back home, do your best not to interact and bring the virus. I don't know how I will feel if I have to bring that virus onto my mother or someone who is elderly, and then a few days later I am getting a call from the hospital or medical practitioner that this person has died. I think that in itself is very, very disturbing and impacting. I want to bring some good news. While Superintendent Henry would have spoken to the restrictions, I want to speak to the entertainers and promoters. There's some good news on the horizon. And the good news is that the National COVID-19 Task Force, in our deliberations, we have agreed to have the Cabinet consider the commencement of major events, as I said, FETs, some FET control FETs and activities as of the month of March. As per the date, we will communicate that with you as soon as we get the consideration and deliberation of the Federal Cabinet of Ministers. We are hopeful that we can get that information to you so that you can begin to advertise your event as necessary. So there's some good news. So we will be communicating with the Ministry of Entertainment, who should be liaising with the promoters, entertainers, etc., so that we can get that sector restarted, but restarted gradually and restarted safely. We're just putting that out there so to let you know that we want you to restart. And the reason why we are saying gradually, we don't want to regress unless we have a major outbreak. So let's get it right so that we don't have to be in a swing back and forth in the river, on the bank. We started right, we get it done correctly, and we have it sustained so that we don't have to look back unless there is a major outbreak. That's the thought process of the National COVID-19 Task Force, and we are here to work with everyone to bring back the sector to a level of operation. I want to speak to the outbound passengers, those who are traveling to their destinations or wherever they're going to. Please understand that it's not the National COVID-19 Task Force responsibility to inform you or let you know what are the criteria required by your destination or from the destination or your intended destination. It's your responsibility to do your research and see what is required if you're going to North America, South America, if you're going to another Caribbean country, or you're going to Europe, Asia, whatever you're going to. Please find out what are the criteria so that you could know how you can guide yourself in terms of testing, in terms of documentation, or quarantine, or whatever requirements that that country requires or they have in place. It's very important. We are focused on the protocols for entry into St. Kitts and Nevis, the Federation of St. Kitts and Nevis, but whether it be by air or whether it be by sea. So our focus is our local national interest. So I just wanted to make sure, because we have been receiving requests to find out what is the criteria for countries, etc. And just like you, we have to go and research and let you know. So we are appealing to you that outbound passengers, it's your responsibility to know what criteria is required to your intended destination. To the football family, community, I have also some good news for you. On the recommendation of the National COVID-19 Task Force, the Cabinet has approved for the resumption of the Female League, the Youth League, and Grassroots League for football, practice, training, and competition matches, in accordance with the protocols submitted by the St. Kitts Nevis Football Association Executive. We are still assiduously working to get the Men's Senior League back up and running. We are going to continue the consultation with the President and his team so that we can have a balanced approach and have our young men playing their football as necessary. We are hopeful that we can have this resolution as soon as possible so that we can inform the general public as well as the Football Association how soon this can occur. While on sports, the Federal Cabinet has also approved the recommendation of the COVID-19 Task Force for the St. Kitts and Nevis Athletic Association under 12, or what they call the, I don't know if it's the junior one, but that's the primary school level to be able to resume along with the targeted athletes. When I say the targeted athletes, this is the explanation by the St. Kitts Nevis Athletic Association, those athletes that compete on a regional, national and regional and international level. Those athletes are fully vaccinated and they can come together, practice and compete in applying their trade, etc. So we are happy to announce that. We are happy that the Cabinet has seen the wisdom and the recommendation of the National COVID-19 Task Force to gradually resume activity in the sporting community. I want to take the opportunity to also thank Simply Help, the Simply Help Foundation, Ms. Tina Bow, and the team for their donation of 2 40-foot containers to the value of over $350,000 US, with a number of relief supplies and also supplies for children, hand sanitizers, masks, face shields, etc., and other items, essential items for vulnerable groups. We will be using the Ministry of Social Services, or the Departments of Social Services, to assist in the distribution of these essential supplies. And we will be targeting institutions such as hospitals, medical institutions, let me say that way, medical institutions. We will be distributing to the schools, in particular the education sector, and also vulnerable groups in our society. We will also be reaching out to a number of NGOs to assist in the distribution of these supplies. We will also have supplies here to help us as we prepare for the hurricane season. That's relief supplies in the event that we are severely impacted in any way. So again, I want to thank Ms. Tina Bow and the founder and president of Simply Health Foundation. Equally so, I want to recognize also the contribution that led to us receiving this donation of 2 40-foot containers of the office of the Prime Minister, in particular the Honorable Dr. Timothy Harris, who was the one who initiated these dialogues with this foundation, and we were able to relieve these. We were able to get these supplies and accessories to assist our population here. So again, on behalf of the people and government of St. Kitts and Nevis, we express our profound appreciation to Simply Help Foundation. Ladies and gentlemen, it's not too early to prepare. The good Lord, I have been at NEMA for 3 years now, and the good Lord has been good. I'm going into my 4th year, that we have not been impacted by any large or significant tropical storm, and that includes hurricane, etc. We have to start to prepare for the hurricane season, and in preparing for the hurricane season, I'm appealing to everyone to do the necessary things in preparedness for. The National Emergency Management Agency has already begun to mobilize in terms of engaging our international, regional, and national partners, stakeholders, so that we can begin this process. I also want to state that we will be undertaking a comprehensive disaster management audit. We will have a consultant who will be coming on island from the 20th of February, 21st of February, and we will require the support of the public sector, private sector, and all social partners to be able to conduct this audit, which will help in us developing what we call a country work program for the next 3 to 5 years, and these will guide the way in which we want to build resilience for the Federation of St. Kitts and Nevis. So we are doing our best to prepare, to protect you, and guide you during any type of national crisis. Thank you very much, Mr. Williams.
Thank you very much, Mr. Samuel. And you kept to your word, you were brief. We now come to the question and answer segment for today's program. And the first question is, when would vaccines be available for children under 12 years old?
The Federation is accessing vaccines for children under 12 through the CARICOM Secretariat, and as soon as we are told or provided a timeline when that batch is expected, we will share that with the general public. So yes, we have submitted the amount that we need to the CARICOM Secretariat, and as soon as we provided the expected date of arrival, we will share this information. Okay, so at present, we are offering the Pfizer-BioNTech vaccines. That's the only vaccine that we have in hand. The current batch of the Pfizer-BioNTech vaccine that we do have, they expire at the end of February. Now, we are trying our best to secure an additional batch of AstraZeneca Oxford vaccines. Now, as soon as the expected date of arrival becomes available, we will share this information with the general public. But we are hopeful that this will be quite soon. So soon we will be able to offer the AZ or AstraZeneca Oxford vaccines again.
Thank you very much, Dr. Laws. This question is from Vaughan Radio in Nevis. Given the recent days of low confirmed cases, is it safe to say that the fourth COVID-19 wave is coming to an end? And the second one, if so, will any of the regulations be relaxed in the coming weeks?
The CMO presented a graph in her presentation where she showed the cases started to rise on about December 24th. They peaked in early January, and we have consistently now seen the recoveries outpacing the number of new cases, and the new cases are continuing to decrease daily. And so, yes, we can say that the fourth wave is coming to an end. When this fourth wave will end, however, depends on your actions, in that the more persons continue to move around without a mask and gather unsafely, is the more the virus can spread, and it can prolong the fourth wave. And so the tail of the fourth wave can be pretty long, but based on the projections, we are hoping that we will be out of this fourth wave in the month of February, and that is why we are making the predictions that we should start seeing some relaxation in March.
Yes, Mr. Williams, just to follow up, and the part two of the question in terms of regulations. So once we have approvals from Cabinet regarding relaxation, for example, as I just mentioned with the mass events that we are hoping that can resume in March, then the regulations have to be changed in order to accommodate whatever recommendation and approvals we receive from the Cabinet. So once any type of relaxation comes with it, comes along and implemented, the regulation has to change to fit those relaxations.
Thank you, gentlemen. The next question, why is it that some bars and restaurants get weekly approval for 3 and 4 DJs, and others can't get approval to hold just one Valentine's dinner with an in-house DJ to play soft music. Superintendent.
I would have indicated in my presentation that there are a number of persons, which include DJs, who are performing or hosting events without approval. I admonish that all persons should have approval, and those persons who are caught operating without approval will be dealt with according to law. Now, those DJs who you would have indicated who are playing, almost on a weekly basis, we have closed down bars for the night. And that is as a result of they having DJs who are performing, who are playing without permission. So we have not been granting any permission for DJs or bands to operate at any night spot. And if you see it happening, it is without approval. And we ask that you just call the Nevis police station and report it.
That looks like it. That brings us to the end of our questions for today. Thank you very much for submitting your questions. We continue to be here to answer your questions, as that is all a part of the management of the COVID-19 pandemic. It's a part of the pandemic response. Education is extremely important because with knowledge, people can know how to act and to be more aware, which is what we want. I want to thank all of the presenters today. Dr. Wilkinson opened the batting. He says that he likes to open the batting. And Dr. Laws, our Chief Medical Officer, Superintendent Cromwell Henry, Mr. Samuel, who works very hard day and night as our chair of the National COVID-19 Task Force. We thank Mrs. Christmas Jacobs, AJ at ZIZ, and all the media houses for partnering with us, and all of us here at NEMA who continue to work, including the PRO, Michelle Rodriguez. We thank Ophelia Blanchard, Marissa Carty, Dr. Marissa Carty, and the Honorable Wendy Phipps, the indomitable Honorable Wendy Phipps. She's always here, always, without fail. Thank you so much to all of you for joining us today. And next week we'll be back with another edition of our National Emergency Operations Center COVID-19 briefing. Until then, take care. Don't forget to protect the older people, the more vulnerable people, especially the younger ones who are going out to parties and the strip and so on, and coming home to their older parents and grandparents. It's important that you protect them. Thank you very much. I am Les Roy Williams.